Hi, this is Chuck Gallagher. My guest is Valda Ford. Valda's been interviewing me. I've been interviewing her. We've been talking about men's health, prostate health, and Valda, in a lot of our conversation, we've said, well, if you catch prostate cancer early, that you certainly can live. I'm living proof of that. I will not die of prostate cancer. Something will take me out of this planet, but that won't be it. But I also know a number of men and some very good friends of mine who seemingly caught things early and had all of the appropriate treatments that were available, and it still wasn't quite enough. It had just escaped the prostate gland into the lymph system and potentially beyond. We need to talk about what some options are at that point.
Right. Well, when you catch it early, of course, you're going to do the prostatectomy or you're going to do radiation. When it goes beyond that, there are a number of different possibilities. I want to read them off just to make sure that I get them.
Sure.
Of course, you can have surgery that is more extensive than just the prostate gland, but you can have cryotherapy. So that is where you're using freezing, in essence, to get to other areas. You can use hormone therapy, and the hormone therapy may be to suppress androgens, those chemicals like testosterone that are what are fueling the prostate cancer. You can use chemotherapy, which you could have used chemotherapy anyway, but chemotherapy is more wide-reaching and is going to get into those other places. Vaccine therapy, so that you are increasing the likelihood that your immune system is strong enough to do the job and fight back the cancer. So those are the typical other options for later stage cancers. Unfortunately, if you're not getting tested, not getting screened, not paying attention to what your body is telling you, then you're going to have maybe your first symptom that you pay attention to is severe back pain or swelling. That means the lymph system isn't working well, or that you have bone cancer. And usually at that point in time, it's just a question of taking care of you in a palliative sort of way, because you're not going to undo all that damage. You can try, but end-stage cancer of any kind typically means that end stage. That's why it's so important to do those testings. And I know one of the things that disturbs me a bit is that recent recommendations are that you don't get PSAs, and that that's not necessary, that it doesn't improve your chances. But I would rather know what my numbers are, to know what I should be looking for. And even though most cancers of the prostate are slow growing, and maybe or maybe not you should have surgery or any of the things we've talked about so far, I want the information in my hand so I can make the decision with a qualified healthcare professional to decide what's best for me. And I'm willing to take the risk if I have the information.
Sure. Two things we might want to go down some rabbit holes with. One, a real good friend of mine found out he had prostate cancer, and he called me because I'm very open about it, obviously. And we talked, and he had surgery. Felt like things were going in the right direction. Pretty quickly after, when I say pretty quickly, within 2 years, his PSA started to rise, and that was a little unusual. Went back and went through radiation. And again, the PSA started to drop. Well, by golly, it started to rise again. And this was kind of wigging him out.
Right.
Ultimately, in talking with his physician and a number of physicians around the country, he wasn't going to limit it to just one person. They came to the conclusion that they needed to do androgen deprivation therapy, which is, in my terms, simple terms, chemical castration. Now, the word castration freaks everybody out. It is not a surgical procedure, although it could be. But there's no point surgically in removing your testes whenever chemically you can functionally kill off the testosterone in your body. And clearly stated, I am not a physician. So the way I'm putting this is in layman's terms, but functionally, testosterone feeds prostate cancer. It is the fuel that fires it. So if you eliminate the fuel, you may not have eliminated the cancer, but you've eliminated its fuel to grow.
Right. Well, there are those two things, the treatments with hormone therapy, treatments to lower those androgen levels. So there's either orchiectomy or the removal of the
physical
testicles,
removal,
the physical
right,
removals. And so that way testosterone and DHT are removed.
Right.
Now, this causes most prostate cancers to stop growing or shrink for a time. Now, then you can get what's called LHRH antagonists. So that's luteinizing hormone releasing hormone. And that's what you were just talking about, where you get the medication and it does all of the same as the castration without you having to have the surgery.
Right. And the thing about it is, now, from what I understand, if that takes place, there are clear side effects. Now, the simple ones, again, from a simplistic perspective, the great majority of men lose libido. And in fact, my friend said, he said, you know, I look at women and I remember that I used to be excited and I remember that I was interested in sex. And he said, it just seems like a memory from a different place. It's like I understand it intellectually,
Right.
but I have no feeling.
Right. Well, that is something that when you look at the symptoms that can be reduced or absent sexual desire.
Right, that's correct.
It can cause erectile dysfunction or
Correct.
impotence, shrinkage of the testicles and penis because those hormones are what making it what it is,
Right.
hot flashes.
And he said that he started to experience that, and he remembers his wife saying, I'm having a hot flash, and he was like, what? And then he said all of a sudden it hit, and he says, whoa,
Yeah.
talking about an oven inside.
They're
Dang.
ugly. They can get breast tenderness and growth of breast tissue because everything is in balance. So you take one away, the other one proliferates because men and women have the same hormones in their body. It's just what balance of them that they have.
Right.
You can have anemia, decreased mental sharpness, loss of muscle mass, weight gain, fatigue, increased cholesterol levels, and depression.
So in his case, he said, I am much more tired than I used to be. He said, at 3 o'clock in the afternoon, I kill for a nap.
Done.
You know, he said, and I have found that I'm a bit more forgetful than I used to be. So a lot of those things that you mentioned are side effects. And somebody could listen to this and say, oh my gosh, I'd never want to do that. Well, yeah, but whoa. Doing that and preserving life versus saying, no, I really just want it to rampantly spread through my body and deal with late-stage prostate cancer, which is not pretty. It's a treatment, let's put it this way, it's a treatment that did not exist for my father-in-law back in 1980.
Right.
And his life potentially could have had better quality or been spared, at least for a longer period of time,
Right.
had he had the option of what, again, I would refer to as chemical castration.
Well, the thing is, there are just so many options for what's going to work for you. Who knows? You just need to go to a center of excellence on cancer so that they can give you all of the options, so that they can say to you, if you're 75 years of age, then perhaps if it's a slow-growing cancer, you'll just say, well, I'm okay. But if you already know that you're in trouble and you're starting to have a lot of symptoms and it's creating the path towards the end of life, then you just want to know all of these options and get the one that's best for you. And is surgery good for you? Maybe not if you already have some heart disease or something else that's going to create it, or you have a compromised immune system where maybe you're not going to heal as well, or diabetes or one of those things. So all of these options are about knowing them, weighing them, and having good information on what's going to work best for you.
One of the things, for those of you that are watching, because this is a medically charged segment, is go to your physician, your healthcare provider, look for qualified websites that can help you, Johns Hopkins, Mayo Clinic, MD Anderson. Now, that's just to name a few. There are plenty of others. But but do your research. In the world we live in today, being ignorant about what your treatments are is unfortunately your fault, because the world is wide open to be able to provide you information. Our job here, Valda's and mine, is to open the discussion so that perhaps you'll hear something here and say, aha, I need to think about that, and then take that a step further.
Right.
And Valda, thank you for the time. We've been talking about men's health, prostate health. Valda Ford is my guest. It's Valda, V-A-L-D-A, Ford, F-O-R-D.com. She has a wealth of information on her site, and I know when you go there and you see some of the blogs that she has written, especially concerning this series that we're doing, there are going to be links there that will help you find some of the answers that I'm sure you're looking for. Stay tuned, and we're going to wrap things up on men's health and prostate issues here in just a moment.